Hello, welcome to the session on PubMed. Here is a group of 18 video series of lectures, and the first session is on Introduction to Literature Search. We need this introduction because there are so many different resources, and it's important to get an overview of where to go for what kind of questions. So, welcome to the first session, Introduction to Literature Search. Here we go. Introduction to Literature Search. First, let's have some icebreaker questions. How do we explain some of these concepts? Websites, search engines, and databases. Very often there's slight blur between these and confusion between all these when people discuss information resources. So it's important to know that when we are on the online space, websites are locations where information resources or search engines or databases are located, usually starting with www dot whatever the resource is. A search engine does the function of searching. So it could be a generic search engine like Google, which crawls the whole web looking for whatever you've searched for. Whereas a search engine within a website searches only the content in that website. What is a database? A database is a collection of data which is organized in a proper structure. The easiest way to explain a database is a telephone directory, which could have an individual's name, address, and telephone number. It could also be that of an organization, of course. But the elements are name, address, and telephone number. It is very organized. Every record in a telephone directory is exactly that. This way, there are many other databases. The databases, again, in the electronic space could be on a website. The search engine in that website searches only the contents of the database. So these three concepts have to be very clear in our mind before we go on to online searching. What are the issues that we face when we search online? Today, we have lots of print resources which are available not only in print but also online. Then we have generic search engines like Google. We can see that if you type a drug name, you get huge number of results. And then we have databases like PubMed, which have a built-in search engine. And here you can see that if we typed the word asthma, we get more than 1,62,000 results. And sometimes when we do a search like this, the very first result is actually about a different condition, in this case, hypertension. So we grapple with all these issues and sometimes just get fed up and give up. Let's go to a step by step approach to searching. For this, first, we need to know our resources and map them to our needs. And we also need to know the principles of searching. Let's go to mapping needs to resources. First, let's define our needs from simple needs to complex needs. We could have varying grades of questions. Here you can see the first question we have is what is Wilson's disease? You can substitute it with any disease, any drug class. Those are all basic needs which we want to have either a basic idea about or a fairly thorough background knowledge. Then we have a more refined question. What are the current advances in the treatment of cerebral malaria? We can see this is a more focused question about a disease. Finally, we have a very, very focused question which we really need for decision making to treat a patient. Let's see how we will map all those available resources online and in print to these kinds of needs. Let's understand the myriad resources available. So, if we had to answer those questions with print or electronic resource, which resource would we go to? For the first question, what is Wilson's disease? We would go to all the basic resources which we have really used right from our school days to our undergraduate degree days: dictionaries, encyclopedias, textbooks, and so on. The next question, which was a specific thing about a disease, we tend to go to journals most often because journals are published with periodicity and there's always something new to look forward to with every issue that comes to us. Journals and the first group, they are all called published information resources. They are in a formal channel of publication and they are available commercially. We also have what are called unpublished resources or grey literature. These are the theses, conference presentations, and most of us know about these resources. But we also have something called clinical trial registries, which are now available in almost all countries. Clinical trial registries are online registries. Anybody who's going to conduct a clinical trial has to register his or her trial in a registry before starting the trial. Once the trial is started, they have to keep on updating the information in the trial right in the registry, right till they reach the results of the trial. So, this becomes a very current information resource when we search online. The last question, which was a decision making question, we have three different kinds of resources for updating ourselves on a focused question like this. The first is systematic reviews. Systematic reviews give us factual evidence. Whether for a question like this, whether artesunate is better or quinine is better, or both are equally effective, or we still don't have a clear answer. Systematic reviews are compiled by people who read up all the available large trials on such a topic and compile the resource. Having done this, we also have sources called guidelines. Guidelines are step to step processes that healthcare providers follow for treating specific illnesses. And we have another class of resources called summaries. Summaries are broader, covering a lot of broad topics. When compiling summaries, authors refer to evidence from systematic reviews as well as guidelines. They also refer to journals and all the primary resources and compile what is called a quick reference or recall kind of document for a whole range of broad topics. Systematic reviews and guidelines are usually on more focused topics. With this slide, what we need to understand is whenever we go to a website may have any one of these kinds or a combination of any of these. Let's go ahead and look at some. As I said, when you visit a website, please check if it has type 1, type 2, or type 3 resources. It could have a combination of any two or all three of the above. Once we know that, then we know if the website will answer our question, whether it is a basic question or a research question or a decision making question. Let's see some examples. If we visit the website of Harrison's Principles of Internal Medicine, it's obviously a type 1 resource because it is a textbook website. If we visit PubMed, PubMed is a resource for journal article references, so it's a type 2 resource. If we visit the Cochrane Library, the Cochrane Library has systematic reviews, which is type 3, and it has bibliographic databases of type 2 resources, which are journal articles. So, this website has a combination of type 2 and type 3. If we visit clinicalkey.com, which is the website of a resource called Clinical Key, it has a mix of all three: books, drug monographs as type 1, journals as type 2, and some of the other type 3. Let's actually go into Clinical Key and have a look. This is the website of clinicalkey.com. You can see that as type 1, it has books, drug monographs, patient education summaries, and some multimedia information tools. Type 2, it has journals. It has a good number of journals. Type 3, it has guidelines and something called Procedures Consult, where there's a summary of a number of procedures. It's really based on the primary first type of resources as well as type 2, as well as systematic reviews, guidelines, etc. So, to recap, when you visit a website, check if it has type 1, 2, or type 3 resources, or a combination of any two or all three. Only then you will know if the website will answer your question. Thank you for hearing this lecture, and you could move on to viewing the other videos to learn more about searching PubMed. Thank you.